We are taking a closer look tonight at the long-term impacts of COVID-19 on the brain.
WSAV's Jessica Coombs is on your side, breaking down some alarming new data.
For many people, it's long-term loss of smell or brain fog, but a doctor I spoke with here at Memorial Health says it'll take years for us to truly understand the long-term cognitive impacts from COVID-19. At the onset of the pandemic, medical experts say they started to recognize COVID-19 as a vascular disease.
We think about all those things that lead to damage in the organs. One of those organs can be the brain, and obviously the thing that we worry about is brain damage, which accelerates aging, and can perpetuate sort of an earlier onset of possible dementia or cognitive syndromes.
Globally, about $1.3 trillion are spent every year on neurodegenerative conditions like dementia and Alzheimer's.
Researchers looked at brain tissue before people had COVID-19 infection and then months after they had this infection. And what they saw was that the tissue surrounding sort of our smell was damaged faster than we expect in a year-to-year turnover. So we do expect brain tissue to diminish over time, but at the rate it's diminishing was much faster in those patients that even had mild COVID illness.
While the research could take years to show the full impact, Dr. Malik Patel says people with higher risk factors could see more immediate functional decline.
But the long COVID, sort of the subtle, mild illness patients, we're not going to see their full spectrum of symptoms maybe till later. However, what we will see is someone who's had the consequence of cognitive impairment, causing them to forget taking their medications like they should, and now they're in the hospital. So what we see is sort of a downstream effect. And what it takes is, for clinicians to be astute and to think about, okay, what is the root cause of why this happened?
Dr. Patel says if you notice any mental decline in yourself or a loved one, he encourages you to go in and get evaluated. He says some cases have reversible causes. Reporting in Savannah, Jessica Coombs, WSAV News 3 on your side.